Public health and disaster preparedness specialist Jeffrey Schlegelmilch joins us now. Jeffrey, this has been an issue long before the first vaccine even rolled off, the issue of inequality. We're starting to see more and more countries receive their first shipments of the various vaccines, especially in Africa, Southeast Asia, South America. So are there any concerns about acquiring enough for second doses? How would you describe the process so far?
Yeah, and I think it's unfortunately, like so many things with this pandemic and with so many other health and disaster related issues, is it's uneven. It's uneven because it's driven by the inequalities that existed even long before COVID-19 entered the global stage. Countries with access, countries with the ability to purchase vaccine, to distribute vaccine, with the infrastructure for which to moving it around. But then you layer on top of that a lot of unevenness in terms of which vaccines are available. Now, hopefully this will start to level out a little bit, getting the attention that it needs to help to even this out, as well as more vaccines become available. But even the logistical challenges associated with some vaccines is very different associated with others. But unfortunately, this unevenness and this lack of access in poorer areas is something that is very predictable and something that we see time and time again. We're good at measuring it, not very good at keeping it from happening.
Yeah, we saw it coming, and we know that the WHO has the COVAX program specifically to help move vaccines to poor and developing countries. What is the status of that program, in your opinion? Do you think it's working?
You know, I think the COVAX model is very interesting in terms of it being developed. I'm not versed enough to really say, you know, it's how great it's going so far, but as a model of sort of pooling resources globally and creating a more even playing field is certainly something that can help, certainly help to offset some of the inequalities that would go from just an every nation for themselves type of approach. But seeing how that plays out as more vaccines come on the market and which countries are able to subsidize that and which countries are actually receiving the vaccine and how that's being distributed within the countries themselves, if it's truly reaching the most vulnerable populations, is something that we need to be continuously vigilant about and making sure that we are working more towards equity.
I want to get your reaction to the story of getting vaccines to people in conflict zones, this move by the UN Security Council. What are the challenges of doing that? Because despite the pandemic, we know there are humanitarian crises happening all over the world. What would it take for that to happen?
Yeah, so there's really a whole myriad of challenges, and even prior to the availability of vaccines, even moving food to conflict areas, as you know, with restrictions and reductions in international travel, makes just getting to places a lot harder. And as you mentioned, you have folks living in congregate areas without access to, you know, being able to necessarily distance or sanitation. It's a more dangerous environment for COVID, in addition to more generally. And then depending on the type of vaccine, so some of these vaccines, particularly the messenger RNA vaccines, need to be kept at very, very cold temperatures up until very close to the distribution of that. And some of these, it's very challenging to get into those environments if you don't have a good cold chain storage and good infrastructure for getting it there. So all these challenges that make help hard to get to places in conflict zones to begin with are made that much more difficult with the logistics involved with vaccine distribution. But with new vaccines coming on the market and new ones being developed using different methods that maybe don't need to be kept as cold, certainly opens up more options, especially with potential one dose and ones that can survive and still be viable without having to be at such extremely cold temperatures.
And we have about 45 seconds left, but I want to get the answer to this question. You know, we see this here in the U.S., equitable distribution of a vaccine, still a big issue. I see it in my neighborhood. I'm sure you see it there in yours as well. But we know that the president is purchasing enough vaccines to cover everyone who wants it by summer. Do you think we'll see more U.S. contributions to other countries outside the U.S., or do you think this country is still a little bit more concerned about vaccinating its own population?
Yeah, I would say that I would hope so, and this is certainly an administration that is much more sympathetic and much more acknowledging of its role on the global stage than the previous administration. So I would expect to see some degree of effort in that regard, but also worth noting that the U.S. is still one of the epicenters of this outbreak globally, and that there's also a lot of need and a lot of inequity even within our borders here that needs to be addressed more fully in addition to globally.
Jeffrey Schlegelmilch, thank you so much for joining us. We appreciate your insight.